Congratulations on making this effort to improve your health care by looking into foot care. We will look into what you can do and why you would want to consider improving your self-care. 1 out of 10 people with diabetes will develop a foot ulcer. Though an annual foot exam is the recommendation, there is more that you can do. Foot care is one intervention that can decrease the risk of foot problems and can promote continued independence. You are gambling too much if you do not take care of yourself. After all, there's only one corner of the universe you can be certain of improving, and that's your own self. So let's look at what you can do. Maybe you are doing some of these things already. Kudos to you if you are. If not yet, consider some of these suggestions. Wash your feet every day in warm water and dry them carefully between the toes. Don't allow extra moisture to remain. Inspect your feet daily using a hand mirror if necessary. Look for these things: sores and cuts that do not heal, bright pink or red skin, puffiness or swelling, difficulty in moving parts of your foot, skin that feels hot to touch, or any drainage. Toenails should be cut straight across and filed smooth to the shape of the end of your toes. Some public health departments and senior citizen centers have foot care days if you want help with your nail care. Wear a well-fitted lace-up shoe or ones with Velcro closures. This reduces the likelihood of developing calluses and ingrown toenails. Specially fitted shoes may be necessary if your feet are in abnormal shape. If the shoe does not fit properly, don't wear it. If you feel you have to break in a new pair of shoes, they do not fit. You may require prescription shoes. Do not walk barefoot at any time, though a physical activity program with shoes may be helpful. Feel inside your footwear to ensure that there are no sharp objects or torn linings that can cause injury or blisters. Small objects could go undetected due to decreased sensation in the feet. Always wear socks with your shoes, but make sure they are not so tight around the ankles that they restrict circulation. If socks have seams at the toes, you could wear them inside out to prevent blisters from the seams. There are socks available that do not have seams. Avoid foot burns by checking the bath water before stepping into the tub. Do not use hot water bottles, electric blankets, or foot spas, and do not sit close to fires. Flaky skin and cracks between the toes may require treatment. Don't try to deal with foot problems by yourself. Call or go see your care provider as soon as possible if a problem develops. Report any new redness, warmth, or broken skin immediately. This is a problem that you need to talk to your care provider about. Use a cream or lotion for dry skin to prevent the feet from cracking, but do not apply it between the toes. And that is what we're going to do next. So pause this video to go get some lotion, and if you don't have lotion at home, do this exercise without it this time. You may notice that there are many kinds of moisturizing potions in the stores and even some special designer foot creams, but that is not necessary unless you want them. Any lotion will work. The point is to do it. Treat yourself to a massage. If you cannot reach your own feet, you may have to ask someone to help you out. By keeping your foot care items in a prominent spot, you are likely to be reminded to do this daily. You will need a small towel, a mirror, and some lotion. There are various ways to massage one's own feet. You can check with your care provider or diabetes educator for their suggestions. Diabetes.org also has good information for your perusal. You are the best judge of knowing what feels good to you, gentle or firm. As you massage, take a good look at all the areas on your feet. You may need good lighting and a mirror, maybe one with magnification, to see the bottoms of your feet. If you are considering having a pedicure done, make sure precautions are taken to prevent the spread of fungal infections before you begin the treatment. You can pause this video again to finish up your massage. Make sure you dry between your toes before finishing up. The U.S. Department of Health recognizes that people with diabetes do have problems with their feet and would like a better focus on this care. The Healthy People Initiative is aware of the problems that people have with their feet and has proposed 2 objectives directly related to feet. reduce the rate of lower extremity amputations in persons with diabetes, and increase the proportion of adults with diabetes who have at least an annual foot examination. The first one, I'm sure we understand. The second one is a can-do. Just take off your shoes while you're waiting at the doctor's office and wiggle those toes. Don't give them any other option but to pay attention to the wonderful work you have done. Just because you have sought out this video, I can tell that you are an active participant in your care. I commend your choice to commit to your self-care. Ask yourself if self-care is a logical, proactive choice for your health. It is only possible to live happily ever after on a day-to-day basis. Thank you for your attention. Again, I remind you that thediabetes.org has more information to help you manage your care and an online magazine to read up on the latest news in diabetes. I hope that this was helpful.